I think we can get started now. Welcome to IHA's webinar, Health Literacy Month Wrap-Up. It is nearing the end of October, and we have a bunch of people who've done some really interesting, unique, and successful projects for Health Literacy Month, and we have 4 of them on our panel today. We have Allison Caballero, Amy Mirabella, Ellen Bloom, and Mercedes Harris, and they are going to talk to us today about what they did for Health Literacy Month in their organizations, lessons learned, so that we can all sort of learn from their experiences and help that in our own planning in coming years. So welcome to the panelists. Thank you so much for being here. And we're just going to get started. Just a couple things. I assume you all are connected to audio using your computer speakers. Everyone's going to be muted during the webinar. If you have comments, please use the chat button. But if you have questions for the panelists, we're going to have a whole, the second half is going to be all questions and discussion. So we'd like it to be, we'd like to get your feelings and your thoughts and your questions about what they're talking about. So please use the Q&A button instead of the chat button for your questions for the speakers. And we'll get to all of those at the end, but we'll have a whole half hour for it. If you have any technical difficulties, you can email support@healthliteracysolutions.org and we can help you out during the webinar. This will be recorded and posted on the Health Literacy Solutions Center website. You will also get the PowerPoints, so everything will be there for you, so you don't have to copy and everything. And after the webinar, as usual, you'll get an email with a link to a brief online evaluation that's really helpful for us in planning. So we appreciate that. And that's also the way that you get your CEUs. So if you requested CEUs, once you submit your evaluation, then you'll get your certificate after that. So I'm going to introduce everyone briefly at first, and then we're going to go one by one. So our first speaker is Allison Caballero. She is the director of the Center for Health Literacy at the University of Arkansas for Medical Sciences. Allison collaborates with campus leaders in education, research, and clinical care, and a host of external partners to advance the center's mission to improve health by making health information easy to understand. She leads the team of expert staff who provide health communications training and a host of services, including plain language, assessment and editing, Spanish translation, health education materials development, and field testing. After Allison, we will have Amy Mirabella. Amy has worked in the Honor Health Research Institute for 6 years as a research nurse in oncology clinical trials, the clinical educator, and is currently serving as the interim nurse manager of oncology clinical trials. She provides patient care, patient education, staff education, and professional development, as well as lead nursing research, evidence-based practice, and quality improvement initiatives. She has a passion for education and the doors that it opens. In addition to her work at Honor Health, she also works as an assistant professor at West Coast University, teaching the RN, BSN, and RN, MSN programs. So welcome also to Amy. Next slide, Scarlett. After that, we'll have Ellen Bloom, who is the Sickle Cell Grants Manager at the Indiana Hemophilia and Thrombosis Center. She has she's earned her Bachelor of Social Work and Masters of Public Health degrees from Indiana University. In her current role, Ms. Bloom is responsible for grants management and oversight and patient health education. She leads advocacy activities for the Indiana Sickle Cell Consortium. Ms. Bloom has a special interest in health literacy and plain language principles and their relationship to health outcomes, and created and leads the IHTC's Health Literacy Work Group. So welcome to Ellen. And finally, we have Mercedes Harris, who is a native from New York City and received her doctoral degree in pharmacy from St. John's University. Mercedes had her first and lasting experience with public health as a young teen working for the city's summer youth program. In that time, she interned at Elmhurst General Hospital, a metropolitan hospital that serves the most ethnically and linguistically diverse communities in the United States. special shout out to you, Mercedes, for doing that work at that hospital, which we know has been in the news a lot in the past year. So thank you. Inspired by her experiences, she later transitioned to a community pharmacist and relocated to Florida to serve the many diverse populations within the state. So welcome everybody, and we will start with Allison.
Perfect. Just wanted to get some visuals up there for you all. Glad to be with you today. Thank you so much to IHA for the opportunity to come and just share a little bit about our story and some of our lessons learned this Health Literacy Month. Just a little bit of background about our center. We've been around for about 8 years now, and I believe this was our 8th annual Plain Pledge campaign, which I'll tell you about shortly. But we've been celebrating Health Literacy Month since our inception. We had a governor's proclamation several years back that's still standing, so we're always excited about that, and always looking for new ways to kind of breathe new life into this month-long opportunity to share what we do, why we love it, and why we think it's so important to so many efforts within healthcare and public health. So one of the things that I'm super excited about this year is our recent work with our interprofessional education curriculum. So as Julie mentioned in the intro, we're part of the University of Arkansas for Medical Sciences. So we have colleges of medicine, nursing, pharmacy, public health, and health professions. And those students all participate in a longitudinal required interprofessional education framework and curriculum. And so I've got this visual here to just sort of help you see how they progress through this curriculum during their time at UAMS. And they all attend, no matter which college they're from, they all attend the same exposure workshop early in their student careers, where they're exposed to some core concepts that we want all students to know. And we're so blessed that health literacy and health communication is a part of that and has been for several years. In this last year, we have had an opportunity to build out the integration of health literacy into the curriculum in these additional phases. So in the immersion phase, there are a number of different workshops that they can elect to take, but they all get an immersion credit of some sort. We were able to do for the first time this year a course within this phase that was dedicated to health literacy. So students do what's called a quadruple aim project proposal workshop. So they work in interprofessional teams to come up with some kind of strategy. They end up putting together a full grant proposal over a 4-hour period together, working in those small interprofessional teams. And their proposal has to address one or more elements of the quadruple aim. So for those that are not familiar, that would be improvements in patient or population health outcomes, in patient experience, in cost reduction, or in provider satisfaction. And so to have health literacy as a focus and say, all right, students, come up with a proposal that advances the quadruple aim by way of clear communication has been really interesting and a great learning opportunity for them. And we were able to integrate this particular course during October this year. So we were excited about that. And then in the final phase of their curriculum, they do what's called a competence workshop. And again, there are many topics and titles that they could elect to participate in, but we've just added the one on plain language writing. And so again, those students work in small interprofessional teams. We talk about the importance of health literacy and clear health communication and the roles and responsibilities based on their expected future role, whether that's in research, clinical care, or public outreach. And then we give them some a really crash course in plain language writing that addresses health literacy limitations. And they take some survey documents and some public facing documents, and they work together to edit those. So we're really excited that we have had a chance this last month to bring these 2 new workshops to touch hundreds of students at UAMS. So we're now fully integrated across that curriculum. I mentioned the Plain Pledge. We've been doing this for many years. You can see a young professional here taking the Plain Pledge. And essentially, this is an opportunity for people to commit or recommit to not using jargon in their health communication. So they take a picture of themselves holding a word that they think is jargon. It could be really scientific jargon. It could be more industry specific jargon, or just not the way we talk across the kitchen table, right? So they place that jargon word in a buster that we provide, and they hold it up and they get their picture taken for social media. We've been doing this for many years. We have organizations from across the country that use this and that use our hashtag, and we're always so glad to see new organizations come on. I have found, though, really this year that the magic, I'm not sure if the magic is in the social media. The magic is in what happens in those small groups. And I'll tell you a story. I went over to visit our patient education department. So a small team of 5 patient educators who work for our inpatient units within our health system, because I said, hey, I want to come over and get a picture of you guys doing the plain pledge. And so as we started talking, and they said, well, what's this all about? And I explained jargon. They said, well, okay, somebody said, I'm having a hard time coming up with a word. And one of the colleagues said, how about elevate? And the other person said, what's wrong with elevate? And the rest of them kind of jumped on her and they said, that there's a much simpler way to say elevate. So in that moment, they educated each other and they gained some awareness that maybe they needed to work on their jargon and maybe they needed to help each other work on their jargon. So for me, that's where the magic is. But like I said, it is a toolkit that anyone can use. Also on our website, we've got some other resources if anyone wants to use those in the future. This is a poster that we put together a year or 2 back with some support from Delta Dental, and it's printable on our website. We've also got some brief talking points for someone who might just have 5 minutes in a staff meeting to talk about health literacy and its importance to your mission. And all these things are available online, and I'd love to share more about those if time allows and to take any questions, but mostly I'm looking forward to hearing your examples as well.
Thank you so much, Allison. That was really interesting. So people think of questions or comments on that we get to at the end. And now we're going to, oh no, I forget who's next now. I forget the order.
Amy. It's Amy.
Amy, yes. Okay. Thanks. Amy, it's on to you. Thank you.
And thanks, Allison. I loved hearing what you guys are doing, and you've been doing this for a while. At Honor Health Research Institute, this was actually our first Health Literacy Month celebration. Last November, we created a health literacy task force, and that was following a study that we did led by nurses who realized a need to provide better education to our patients. Oncology clinical trials can be very cumbersome. We're dealing with patients who may not have a lot of options left, those types of things, and their stress level and anxiety is high when they come to us. And so we know that changes how they receive information and what they do with that information. So we developed a nursing-led study. We used the AHRQ toolkit and developed educational modules that utilized this universal approach to health literacy. And what we found was astounding. The way the patients received the information, they were able to create goals that made impact in how they managed symptoms, when they called the clinic, how they really took charge of their health. And when we were done with our study, the feedback we received from them was, what's next? How do I involve my caregiver? What are you going to do? And as nurse researchers, we knew we couldn't stop there. And we went to leadership and proposed an interdisciplinary health literacy task force, which leadership has been supporting us from day one. So they said, absolutely, start working on that. And so we gathered people who had an interest in this work, understood how what they were doing in their different departments could be impacted by health literacy and how that would then impact the patients. And we all came together, and one of the first things we did was a needs assessment. And that was even more affirmation to us about the changes we needed to make. So we were really excited about gearing up for Health Literacy Month and helping spread the word. Our research institute has many different departments in it. We're just one little part of that, and that's oncology clinical trials. We have cardiovascular, we have bariatric, we have neurotrauma, and some others. So this was housed in oncology clinical trials with our movement forward to include the entire research institute. So our big part for the month was to spread awareness but then get people to see what small actions they could take that would make a difference. So one of the first things we did was all the task force members got health literacy t-shirts. So we all wore the t-shirts that had the Health Literacy Hero logo that we kept seeing on the IHA site. We took that and turned it into a t-shirt, and that sparked a lot of conversation. We wore that to work and people would stop and say, hey, what does your t-shirt say? And then we could start talking about what is health literacy and why is it important. We worked with our marketing team. So we have a Facebook page for the Research Institute. And that was great because they posted little snippets on there about health literacy and who they could reach out to for more information. We also did some tweets, those types of things. And then we wanted to get the entire hospital system that we're involved, that we're part of involved, and that includes 6 different hospitals. So we had this conversation about what can we do there. So we were invited to present at Nursing Grand Rounds. And Nursing Grand Rounds particularly is for nurses. Ours happened to be advertised as interdisciplinary, which is how we wanted it to be. And we had quite a few people show up for our virtual presentation. We talked about what we had learned and why the importance of the work of health literacy and how that impacted patient outcomes. And then it was interactive and we asked people to start thinking about what is something they could go back to their unit and actually do. So one of the things that we heard was, I'll sit down at the patient's bedside and give the information, provide the education versus standing over them, because we know what a difference that piece makes. We heard from others that were things, we talked about plain language and we introduced many people to plain language. I'll use the term medicine instead of medication. And so we got people to understand that it was just these little pieces that could really make an impact. We weren't asking them to change the world overnight. CEs were offered, and so that was a great way to bring people to Nursing Grand Rounds. And then I think the interactive piece, we really had more people participate than what we anticipated. We also set up an information table over at the hospital that we're across the street from. We had a spin the wheel game where they might land on a word and they had to change it to plain language. We defined health literacy. We had handouts, we had candy that lured them to the table, of course. And then we took that game and we put it on a cart on wheels and we rolled throughout the Research Institute, going from department to department and engaging people in conversation. We're also having a competition this month throughout the Research Institute for the department who comes up with the most actionable items and ideas related to health literacy. They're going to win an ice cream party. So it was getting people to think not just about how I receive the information and sure, I understand what health literacy is, but what changes can I make in my department regarding that? I mean, I think the exposure to plain language was big. We know people talk in language that we don't use at the dinner table. And so we tried to change that and we did that in little pieces. One thing that we learned was that we really needed to be creative in how we engaged people. People did not have a lot of time to sit at our table or play our game. They had to get on to eating lunch or getting back to their unit. And so an elevator speech, quickly defining what is health literacy, how can it impact patient care, and what can they do? And then following up with them after that to help them figure out potentially a quality improvement project or something even smaller than that, and how we could track that and the impact that would make. And so we're really looking forward to expanding outside of oncology clinical trials. We have been asked, because there's so much buzz with leadership and throughout the hospital system, what resources do we need moving forward? So I'm currently working on a business plan that I will be proposing here in the very near future, because we truly need it. But we've had great response this month and people are excited about learning more and putting some of our upcoming teachings related to health literacy into practice. Thank you.
Thank you so much, Amy. That is great to hear about. You're gonna have to tell us later who wins the ice cream party. So next up is Ellen. Please tell us about your project.
Hi there. So I work at a blood disorders clinic. We see patients with hemophilia, sickle cell disease, thrombosis, and other bleeding and clotting disorders. And so you can go to the next slide, Scarlett. So a lot of what we talk about is really complex. And so about a year ago, we created a health literacy work group that we hoped would really advance health literacy and plain language principles at IHTC. And our goal over the past year has been to try and get those principles to be part of IHTC's culture, like just something that people will always have in the back of their mind. And so I included what we've done over the past year because I thought that might be helpful to people as well. We have a biweekly staff newsletter, and we have an article in that every issue. And those might be examples of rewriting some text into plain language. We've interviewed staff members to talk about how they use plain language with patients. We include links to interesting articles, just all sorts of stuff. The work group members have spoken at team meetings, just again to get everyone familiar with like, this is the basics of health literacy, and this is something that we are working on at IHTC, just so everyone's aware of it. And then we've also developed a formal process using REDCap for staff to submit documents to be reviewed by the team. And you can see in this picture, this is a staff member's nameplate. And so one of the things we do for every committee is have like a little ribbon to recognize that someone's a member of that committee. So we created those for the health literacy group too, just again, to get everybody aware that this is a group that we have now and something we're working on. Go to the next slide. So when we were talking about Health Literacy Month, we wanted to incorporate the idea of health literacy heroes. And at IHTC during COVID, we had something that we called the Semper Gumby Award, meaning always flexible, which staff members could recognize their coworkers who had shown, extra adaptability during a strange and chaotic time. And so we used that idea to come up with our health literacy hero. We decided to use Pokey because he's Gumby's best friend. And so plain language Pokey and Semper Gumby go together. And so you can see him here. We gave him a little cape because he's a superhero and it has our logo on it. And staff can nominate themselves or a coworker for this award. It's just, you can kind of see here the criteria for it. And then that screenshot in the bottom right corner, our marketing manager actually created a video introducing plain language Pokey to staff. And so in the video, plain language Pokey is talking to a doctor about his hemophilia and kind of teaching the doctor about plain language. So that was really fun too. You can go to the next one, thanks. We also had a quiz, which again is just to kind of keep this in people's minds. So staff could take this quiz just to sort of see what they know about health literacy. Regardless of how well they did on the quiz, they're entered into a drawing for a gift card. So hopefully that encourages people to take it, even if they feel like they don't know anything. They'll learn something and then also maybe win a prize. We've had I would say about a third of our staff has taken this quiz so far, which I was really excited about just because this is our first year doing anything. And so I was really pleased to get any kind of engagement at all. Next slide. And then we also just have some displays throughout our center. So we have some infographics posted, and also on our break room on the TV in our break rooms, we have some slides about plain language that show plain language Pokey, like kind of talking through some changes that you can make to make something more accessible and understandable. Next slide. So here's what we learned this year. It's important to know your audience, and the culture of our clinic is very much one about recognizing coworkers, which is why plain language Pokey works well. And we have gotten several nominations, which I think we'll recognize over the next couple months to hopefully keep this going. So it's not just a Health Literacy Month thing. We can keep doing this throughout the year. People at IHTC are also really competitive. So the idea of winning an award, taking a quiz and seeing how well you can do on it those are things that appeal to people there. And then having that tangible reward of possibly getting a gift card or a little pokey action figure is something that motivates staff, as well as that company-wide recognition. We also built upon some existing agency frameworks by incorporating plain language pokey into our little Semper Gumby tradition already. Drawings for prizes are huge at IHTC. We do them all the time. So this goes right along with that. And then we also asked for help. So our marketing manager was extremely helpful during this, helped us with the slides and the infographic and the emails promoting everything that we did. She's just been wonderful. And when I started the work group about a year ago, I recruited a senior leader at IHTC to be our health literacy champion. And she's been really helpful this month with getting things approved that we wanted to do and getting management on board so that they can also help to encourage their staff to be involved as well. And that's all I have. Thank you.
Thank you so much, Ellen. That was great. Last up, we have Amy, and then we'll all see what questions we can share. So I'm sorry, Mercedes. On to you, Mercedes.
Thank you. All right, thank you once again for hosting me and allowing me to share my experience with health literacy for the month of October. So you could change the next slide. The next slide. Okay. So just to reiterate, we started in 2018 and we're a mobile teaching kitchen inspired by Harvard T.H. Chan School of Public Health and the Culinary Institute of America's Healthy Kitchens, Healthy Lives Conference. So that blends the disciplines of health providers with culinary professionals to improve public health outcomes. We were intentional to be mobile, to be accessible to the communities in need with a focus of underserved minority populations domestically and internationally. Next slide. So what exactly is a teaching kitchen? A teaching kitchen is a learning laboratory in which participants of all ages, youth to adult, learn topics ranging from cooking techniques, self-care skills, nutrition education, and disease monitoring approaches. With the growing rate of chronic diseases globally, innovative approaches are needed to meet the needs of the public and stakeholders' interests. Next slide. Okay. So as a healthcare provider, working within a team-based model allows specialties of participants or patients' healthcare team, ranging from doctors, nurses, pharmacists to dietitians, the ability to perform to the fullest extent of their training, all while conserving resources. So in this big slide, it just mentions a study in which implementing a teaching kitchen over the course of 16 weeks amongst 40 participants improved biomarkers such as body weight, blood pressure, and total cholesterol. Next slide. So when we decided to implement the teaching kitchen, we witnessed an increased rate of retention or participation attendance at community health fairs. Next slide. So we would cater our outreach events to bring awareness towards the month's health awareness spotlight. So for November, we showcase American Diabetes Month, education, and a culinary dish to complement the education that was presented. Next slide. And then again for breast cancer for October. Next slide. And then to create interest and added benefit, we included a cooking course with programs such as the CDC National Diabetes Prevention Program. Next slide. So to be short, we targeted all demographics and vulnerable populations. We held youth cooking courses and summer camps. Next slide. So to provide them with the life skills necessary, we reviewed various topics ranging from a fun Q&A quiz for learning retention. In addition, to keep the youth engaged, we asked them initially what foods they were interested in cooking and made their desired dish during that time period. Next slide. And then some students expressed they wanted to make curry chicken, while others stated they wanted to make rice and peas. Next slide. And then another student wanted to make homemade spinach pasta, and we made tomato sauce as well. So they were excited because it adds the effect of teaching, when not really, because they're so engaged in having fun. The education just comes, and it's a remarkable experience. Next slide. So in the last day of the cooking camp, building upon the skills learned over the course, they had a cooking competition to showcase their newly acquired skills. And just similar to the cooking shows that you see on television, they made teriyaki chicken, plantain, rice and peas, and a pineapple boat with the guest judges. Next slide. So knowing health literacy is needed across borders, we traveled to Barbados and met persons where they were. We conducted our classes in the country's governmental polyclinics to educate waiting persons. Next slide. Then COVID hit, and we used that time to strategize from in-person sessions and adapt towards offering virtual services. Next slide. And then we restarted our in-person programs this month to mark Health Literacy Month, American Pharmacist Month, and other health awareness events to better serve the community's needs. Next slide. However, we learned many lessons along the way, beginning with, to second what Ellen mentioned, adapt your approach to your audience. Each demographic is different and may have access to different sets of resources, including funding. Utilizing QR codes have been a great resource in information sharing for us, including desired participant action conversions. Next slide. And then 2, relationships take time. We've been on this culinary medicine endeavor since 2018, and coming from a New Yorker, I've learned the virtual patience. Additionally, gaining the trust within a community takes nurturing and time. For example, if a community has not had outreach events in a long time, garnering trust may be a challenge. However, through providing quality services, word of mouth is a valuable tool in exponential growth, as well as connecting with professional organizations, social media channels for awareness promotion. Next slide. 3, listen to the needs of your audience, get to know and understand their unique needs. To go back to a collaborative approach in care, we ask class participants baseline questions, such as what foods do they like, how long do they spend preparing meals or spend in a grocery store. This helps better allocate resources. If a program is not conducive to their needs or their lives, you would lose adherence amongst your participants and create unfavorable outcomes. And then 4th, be genuine. Providing testimonials are a powerful tool in eliciting behavior and psychological change. Especially as public health professionals, persons may be apprehensive in disclosing certain health information, such as anxiety leading to white coat syndrome. This creates a potential barrier. Sharing a personal story helps remove this barrier and allows your patient or client the ability to open and share their experience. Next slide. So learning the interests of the participants, we made meals that they liked and were interested in trying, such as preparing sweet potato fries from scratch, all while achieving the goal of preparing meals that fell in the parameters of healthy, quick, and at or below $10. Next slide. Thereby leading to behavioral changes such as change in grocery store shopping patterns and family meal cooking adaptation within a week of starting the program, which is remarkable. Next slide. And then lastly, don't let your expectations overshadow the reality. You may have an event planned and everything on your end is going great. You're offering door prizes, cash incentives for attendance, and the day of the event, no one shows. But don't let that encounter deter you from your goals and objectives. Stay the course, adapt your approach. The reason may be a community has been chronically underserved. Residents may not be aware of new programs being offered. However, be mindful to celebrate every accomplishment. You deserve it. Turn lemons into lemonade. In this example, the class allowed for a more intimate, personal environment that led to the opportunity of developing a pilot employee wellness program and ended with class attendees stating, "I never knew healthy food could taste so good." So the lessons learned throughout this journey and impact seen is my motivation to stay the course. The next slide. Just thank you. That's it.
Right, thank you so much, Mercedes. That was interesting. So I like that I like that we had 3 examples of people who were promoting health literacy, among professionals and providers in their organization. And then Mercedes' example was a project that worked on health literacy for the population. So it's nice to see both sides of that. And I also like that everyone had some kind of sense of fun in their project. So it made it interesting and sort of incentivized people. It was a little different than the usual routine. So that was a nice feature. Do you all want to put your cameras back on so that you can all be on here while we go over questions? And, at any time, please, panelists, jump in. If there's something else you wanted to say or comment, just please feel free to talk. This is a discussion. And people in the audience, please, if you have more questions, put them in the Q&A. We have one question now for Ellen, and someone's interested in the quiz. So she asked, would it be possible to share all of the questions used for the IHTC Health Literacy Staff quiz? Their agency is looking at sending out a survey quiz to staff and start the conversation surrounding health literacy. So I don't know if you can share the questions. Maybe not now. Maybe if if you can't do it now, we can maybe on the discussion list. At later we can do that. So
Yeah, that I think I could do it that way. And I can tell you, I Googled health literacy quiz to get some inspiration for these questions. So you can also definitely find some questions that way too. But yeah, I can send them to Scarlett or something, and then she could send them out to the group maybe.
Yeah.
Okay.
Yeah. No, that would be great. Yeah. Thank you. Okay, great. So let's see. So I have a question for Allison. So you had the health literacy segments put into the medical school curriculum, correct?
So it's actually our interprofessional education curriculum. We do have some inclusion in medicine and other colleges as well, but this is our interprofessional education curriculum that's taken by all of our students across colleges.
Okay, great. And I'm wondering how it worked. I know that it's always really hard to get added things put into curricula in health professions because they have so much to learn. So I'm curious how you got people. I mean, it might be that the interprofessional concept does that for them, but maybe
so there's a little bit of that. So our interprofessional education curriculum is guided by the Interprofessional Education Consortium. They have a framework that's got kind of 4 core areas for education, and communication is one of those. And it explicitly states that means communication that's effective and empowering, not only between different interprofessional team members, but between any healthcare provider and their patients or their public that they're serving as well. And so that framework that IPE is built upon really lends itself to communication support. And so I think that is super helpful. And, we've just got some great advocates in our Office of Interprofessional Education office who know about what we do in the center and support our work. And one of the big things that they teach a lot of in IPE is the quadruple aim. And so it is very easy to connect clear health communication with all 4 of those aspects of the quadruple aim. And so we articulate that, they have embraced that, and that's now part of, again, that exposure workshop that all students get to see those connections early on and to see how their communication might have an impact on those different areas. But then they also have those opportunities throughout in their other phases to learn more and to dig deeper.
That's great. Okay, thank you. No, that's great. I wonder how many other big organizations have an interagency professional council. I mean, it's such a great thing, and it's such a great vehicle for health literacy because it's so multifaceted. So that was really interesting to hear about.
I'm really excited about it because it's really going to spill over into faculty development as well. In fact, just next week we have a simulation research day, and faculty are presenting their simulation learning projects and studies. And I'm on the agenda to wrap things up to help them make that connection between health literacy and those efforts. You know, those are skills that students maybe don't get a chance to learn and practice as much as we would like throughout their training, because as you said, Julie, it's really hard to get something new added to curriculum. But we're going to help them kind of bridge those gaps between communication and accreditation standards. So kind of speaking that language of what those course directors are interested in and accountable for will help us kind of get a foot in the door. And so we're looking forward to doing some more faculty development to help faculty members integrate health literacy in creative ways like simulation.
That's fantastic. Yeah. And I think like you said, the fact that it's so easy to connect to the quadruple aim really helps, because that's that guides so many allied health profession work. So yeah, thank you. Okay, so let's see. We got that for Ellen. Okay, so so this is for Amy. So I love that you added, fun things like the spin the wheel and the t-shirts, and I like that you used some stuff from the Health Literacy Month website, which is great, because that's why it's there to help you guys, find the resources and the extras to do your projects. So question is, so you said that you had a sort of a contest with an ice cream party of which departments participated most or will, and I'm just curious, like how which departments did you notice participated more or less, and did you notice reasons for that?
So that's a great question. So we're waiting to give them through the end of the week, so we haven't tallied things, but yes, definitely our departments that are patient facing on a regular basis have participated more than those that haven't.
Mhm.
I met with our patient financial counselors last week to talk about how they might implement some of these things into their department, because their discussions with patients are critical. Talking about the financial piece for patients to make those informed decisions to sign consent for a clinical trial. So I'll be anxious to see at the end of the week if we get some of these other departments that may not see patients face to face every day, what ideas they come up with.
Yeah, no, that's nice. I can see how that's a bit more of a challenge. But the fact that you offered it to all departments, maybe can help them come along and figure out why their department is also needs to follow health literacy.
Right. And our next step will be teach back training for every department that either interacts with patients on the phone or face to face. So that's coming out here in the next couple months. And I think it will help elevate some of our staff members to see how, when our patients check in at the desk, what that interaction looks like affects their entire clinic visit and truly has an impact. And because of that training that we're gearing up for, we've been asked to present on a monthly basis to the new graduate nurses, which are one of our largest workforces in this system that we work in. So we'll be teaching health literacy and how do we use health literacy in plain language to engage and empower our patients.
That's great. That's great. So your first Health Literacy Month project turned into sort of a regular education in your system.
Yeah, it's been really exciting, and we've been so lucky to have so many people engaged, including our leadership.
Mm-hmm. That's great. That's great. That's a question I'm going to ask all of you in a minute, just the buy-in piece. But first, I want to ask Mercedes. So you had the only one that we talked about here that focused on the general population rather than providers. And so I'm curious how you recruited for these cooking events, and also how you think that the participants sort of learned to understand, cooking and nutrition better, which is sort of the piece of health literacy that one of them that applies here. So if you could speak a little bit to that.
I think it's my background being from New York and working, being in pharmacy half of my life. you're always with the public, speaking with the public, and finding what you have to develop a conversation with them on the fly.
Mhm.
So you have to be quick, nimble to develop a conversation and to garner their trust too, because a lot of people are apprehensive with divulging medical information. So with our programs, we realize when you're learning and using all your senses, I'm more visual. That's why you see so many pictures in my PowerPoint. My husband, he's the chef. He's more wording. So that's the main thing. So we realized when you're using all the senses, it just garners acceptance. So when you had this, when we would do in the first year of the program, it's a company, but it's more of a nonprofit because we were more in the community doing the outreach. Once the smells started going in these auditoriums, you just had people coming and staying the whole time to the end. One time we did a church event, and the name of our company is 5 Loaves and 2 Fish, based on the Bible story. And my husband had a big stock pot of soup. And it was just like a Bible story. The participants were like, is this pot ever going to end? Because it just kept feeding like hundreds of people that came. So the whole aspect is learning and meeting people where they are. Some people are more visual learning, more people are auditorial learning, and that's it. That's where we get the conversion. So we started the program again for October, and just starting the first Tuesday in the month. And just within a week, because we hold the programs every Tuesday, one of the ladies said, I went to the grocery store. She got the products that we made in the recipe. She prepared it for her family. And you could just see how me being a pharmacist, wanting to improve outcomes, blood pressure, sugar, and stuff like that. And when you bring in food, it converts their cycle. It's just so crazy how psychology works. So that's basically it. That's why we go with it. I love food. My husband loves cooking food, so it's a win-win.
Oh, that's fantastic. That's great. And it's so, it's tactile, like you said, it's like, this is one thing that you really can use all of the senses, because, what else can we include taste in? We can do like tactile things, we can do auditory, visual, but this one includes taste also. So, no, that's great. And yeah, food is really the way into people's hearts, right?
Exactly. If you don't know much, again, being from New York and having the exposure to all the different cultures, you might not know everything about that country, but if you could name one dish, you already have a conversation already.
Yeah, great. You think there'll be a cookbook in the future?
I told my husband, because right now we're doing a diabetes prevention program. So it's for the 6 months initially. So I'm like, you already have 24 recipes going. You should have a cookbook right now. Yeah. Because the main thing is, in certain articles, they stress Mediterranean diet or certain dietary. But when we go into the communities, especially Barbados, they import a lot of their goods. So a head of cauliflower, they quarter it in the supermarket. So a quarter head of cauliflower is $6 American. Wow. And if some people are making $2 US an hour, they can't, even though they want to eat healthy, they're not able to. So when we did these programs in the polyclinics, in the waiting areas, initially they were like, you're going to do cooking classes in the waiting area? But the thing is, we brought in the package of ramen noodles and asking open-ended questions. One of the participants was saying that for her child, she gives him a pack of ramen noodles mixed with corned beef, which are both laden in salt, for breakfast. So really meeting where they are to help improve outcomes. Yeah, no, that's great. Thank you. Real project-based. Here's another question for you, Mercedes. Do you host any events for free? I know that the areas I serve, this is from Taryn, it is hard to get individuals in the door if the event costs. And also, how did you manage the teaching kitchens at community events? Do you have multiple demos or just one big one? My husband, he prepares a whole meal. So because we really want to strive, again, even with me, even though the pharmacists, we're still on budget too, especially in this current climate. So we want to make sure that the meals are readily accessible. You don't have to go through 10 stores to get certain items. So everything is readily accessible. In a Walmart, everything is under $10 or at $10 to compete against all the factors of a Popeyes, a Church's Chicken, and such like that. So initially, like I was mentioning before, in 2018, it was more like outreach, getting our word out there. And then now adapting our business towards COVID, realizing we could do virtual, and then also catering to suit the needs of the community. If a certain demographic can't handle $100 session, we supplement in other ways, because the main thing is we could go to higher income areas, but the need is in underserved resources. So it's just gonna continuously compound the issue if we don't focus on underserved communities. So we just cater the pricing to match the needs, because we just want the information out there.
Yeah,
Yeah.
great, thank you. Okay, so I have one question which anybody can answer, and then I have one that I'm gonna ask you all to share. The question for anyone is any particular secrets, or how did it go to get buy-in from leadership for your respective Health Literacy Month projects? Not everyone has to answer, but if you have something, feel free.
I'm happy to start. So I think one thing we did with the task force in place was we made sure we had people from the task force at the meetings where we needed to be.
Mm-hmm.
And we kept talking about it. We kept talking to patients about it. And we also had our study that showed by using this universal approach to health literacy that there was an impact there and patients wanted more. We also showed up at many meetings with the AHRQ toolkit. There's things in that have been invaluable to us moving this practice forward. And we just keep talking about it, and we've networked throughout the system. And I think when I get a message and it's like, guess what? The leaders are talking again about your health literacy work. That's exactly what we want to happen. So none of us on the task force have been quiet. So I think that's been a huge plus.
That's great. That's great. Thanks. Anyone else?
I can answer
Okay.
as well. So I had mentioned that we relied on our senior leader champion to really help us get buy-in for our activities. But that relationship with her goes back a couple years. It's probably been about 2.5 years since I first mentioned to her that I thought we should have a health literacy work group. And it just took a lot of persistence on my part to keep bringing that up to her. And she had me do a couple projects along the way to kind of help convince her. And but I think that persistence of just identifying the person at the top who could help me the most, and then not letting her forget about what I wanted her to do was really helpful.
That's great. That's great. So yeah, so those are two really good suggestions. This is a question we get all the time. How do you get buy-in? So yeah, from Amy, yeah, show them research that shows an impact on patients. That's a good one. And Ellen, yeah, having a champion health literacy advocate at the top level is excellent. So thank you. Okay, so I just have one more question for each that I'd like each of you to answer if you could, and just briefly, but what name one thing that you think made your program a success, or one piece of advice that you would give to an organization who is just thinking for the first time of starting a Health Literacy Month project.
I can start this one with the Plain Pledge, because it's the one that I'm most familiar with. That's been around since before I was part of the center. And I think what we've learned along the way is that this is a great project but it also needs some finesse, because there are so many people who could take the Plain Pledge. Like your group of potential participants for something like that is huge, right? Especially if you're using social media. And so what we've found, though, is that we tended, maybe around year 3 or 4, that we tended to go back to our mailing list of folks, our friendly people who already love and support our work, and say, hey, it's time again. And they're thinking, we think they were thinking, gosh, I just did this. Didn't I already do this? And so that made us think about, there are so many other participant groups that we need to reach out to. So most of the past recent years, we have chosen a specific group. So one year it was our research community on campus. And we said, let's be really intentional about going and making some visits with our research community and getting them to engage in the Plain Pledge. And then this year it was our patient education department. Who knows who it'll be next year, but being really intentional about that so that we can go deep and not just kind of go wide, if you will. So really thinking about who can benefit and thinking outside your traditional box, because there are so many people that could benefit from participating in these things.
Great. Excellent. Thank you. Thank you, Allison. Anyone else? Piece of advice? What made it a success?
I think
know you guys shared some. Go ahead.
one thing that helped us is that we started planning really far in advance. We started talking about how we started the group last year in time that technically we could have done something last year, but just weren't ready. And so we've been discussing this and talking about it for probably about 9 months. And that really helped because it gave us time to think of ideas that would work best for our agency. So I think giving yourself plenty of time is helpful.
Great advice. Thank you. Thank you.
I wanted to add, this is Mercedes, just seeing how powerful word of mouth is, especially when it comes to food. So it's just like a snowball effect. Again, I had to learn patience so much. My husband's like, be calm. He's from the Caribbean, so everything is more calm and laid back with him. So he's like, just stay the course. It's going to develop. So, and a lot of people were skeptical at the time because I was like, how is it we're giving people money to come to the event and there's no conversion, you know? So when I was researching and looking at the studies, I realized, you know, patients are apprehensive with medical providers. Even if you're, you know, having a product with food or cooking, depending on their past experience with someone that did do a cooking event, it wasn't worthwhile. So even though you're hosting a cooking event, they may say like, it's probably gonna be like the last event. So that's what I'm saying, making sure that you have quality in your services, because again, with me, this is my passion. So we're gonna make sure that it's top notch. So my husband currently works at Waldorf. So when we do go to under-resourced areas, his main thing is he wants a Waldorf experience there. And they shouldn't be any different from coming from a higher income neighborhood to a lesser income neighborhood. So it just takes time and it will come. So we have a program tomorrow and it's just with word of mouth. They're getting all their friends to come. They're like, you can't beat this. They keep talking about the recipes from 2 weeks ago now. So
great. That's great. Of course, if you do a good job, which you clearly did, then people really will talk about it.
Yeah, but I would add, like, I know the CDC is named National Diabetes Prevention Program, but some of the patients that are participants that come are diabetic. And they said, the reason why I came is because it says health and wellness. So if it's a diabetes prevention program, they wouldn't have come.
Okay.
So we use the wording health and wellness just to encompass and just to iron it out. But basically we're going based on those educational teachings. Yeah.
Great. Okay. Thank you guys so much. We have just a couple minutes left. And so I just want to, again, thank our panelists, Allison, Ellen, Amy, and Mercedes, for sharing your insights and your experiences in Health Literacy Month. Are we gone? Hello?
Yes, we're still on.
Okay, something just blanked out on my screen. I don't see it anymore. So anyway, thank you all who participated and came to the webinar. Thank you so much. And please fill out the survey and we will see you at the next webinar, hopefully. So good luck in all your Health Literacy Month plans for next year, maybe. Thanks again, everyone.
Thank you.